Our focus on the unfolding situation in India right now. Delighted to be joined on Microsoft Teams by the founder and chairman and managing director of Aster DM Healthcare, Dr. Azad Moopen. Dr. Moopen, good morning. Thank you for joining us.
Hi, good morning, Richard.
Well, let's begin with the situation on the ground in India. You have 15 hospitals and clinics in India and a medical college. What can you tell us?
Yeah, situation is really alarming, and it has gone sort of out of control for the last 1 month especially. So we were in fairly good position, but it is increasing, the rapidly spreading in many of the states, and so people are, and there is a breakdown of some of the areas like the oxygen oxygen supply and ICU care. So the overall situation doesn't look very good, and there is a requirement for everybody to come together and see how this can be addressed. So what I feel is that it's a very great emergency, big emergency, which has to be dealt with as a national emergency and dealt with everybody, along with support from the other countries.
So just to clarify, I think it's 14 hospitals you have, more than 10 clinics and a medical college across 5 states in India, stretching from Maharashtra to Kerala. Is it different in different states, or is this an India-wide situation?
Yeah, it's slightly different. Everywhere there are problems. Maharashtra is the epicenter, Mumbai especially. But now it has gone to Bangalore, where we have 3 hospitals. And also in Kerala, there are large numbers. But when you look at the mortality and the preparedness, it is much better in Kerala. The death rates are very low, less than 0.2 or something like that. So the overall preparedness is different in different states. And the government is taking over the beds in the private hospitals. And so that's required because they have to provide the patients from all classes access to care. So that is happening, which shows that the government machinery is not able to live up to what is required. So there is a difference in the overall outcome, but the numbers are increasing everywhere because this is a new mutant which has come in. It is there in all parts of India.
Well, talk to us as a medical doctor, if you can, about these new variants or mutations or double mutations as they're sometimes described. What can you tell us about them and what can be done about it? Yeah,
so viruses mutate always. Some mutations weaken them and some mutations strengthen them. So this can have 2 impacts. One, it can spread. So that is happening, definitely. This double mutant, which is a new variant called B1617, it is definitely spreading much more stronger than what it was earlier. The second thing is how strong it is. Is it producing more of mortality? It is will take little more time, but it looks like it is also producing because it has gone to the younger population. So this is something which is being detected from 10 states in India. And the whole fear is that does it have a escape mechanism against the previous infections as well as the immunization, vaccination? If that is the case, that is going to be really a very serious situation because in India, about 135 million people have been vaccinated, which is a low number. We have 1.3 billion. It's only 10%. But the situation will become even worse. The worst fear is that this can happen to the healthcare workers who are mostly protected. The government, when they rolled out the vaccine, the initial vaccination was for the healthcare workers, which was the best thing to do. So if the mutant is not something which has got protection or the people don't have protection, it is going to be a big disaster.
So what can you do on the ground in India? We heard from our previous correspondent, Tina Thacker, the journalist in New Delhi, saying it's difficult to get hold of not only oxygen, but other medical supplies because people are hoarding and profiteering. What are your hospitals on the ground doing to get hold of oxygen in particular, but other medication?
Yeah, luckily in Kerala, like what I said, because of the preparedness, there is an excess of oxygen, at least at this point of time. But Richard, what I am really worried is the overall, there is a bomb sitting there, which the numbers which we hear now, the 300,000 cases in a day, which with 300 deaths are I think it is the tip of the iceberg. There is a much larger problem. And I have a feeling that if we don't take very, aggressive measures like a war footing, there could be situation where there will be lack of ICU beds, lack of hospital beds, and lack of healthcare professionals. So there is a requirement to improve all this. So I see the army coming in and all the machinery being now put into practice, put into action. So I think it's extremely important even to bring the medical students, the nurses, paramedics, everybody into action without waiting for all the approvals, because it's a war situation according to me.
Finally, what can people here in Dubai and the UAE do? You're based here in Dubai at the moment. What can we do to help?
Yeah, so we are doing whatever is possible. I have been running around to see if there is an opportunity to get oxygen supply. Then understand that it can't be transported. So you have to have units in India, which we are again trying. And of course, the availability of our hospitals. We have opened up our medical college for COVID cases where there are 1,000 beds. Earlier, this was all for non-COVID. So we are opening up our beds. And people here, I think, can most important thing is to provide confidence to the people who are back home and instruct them to remain at home, and also to see that they wear masks and take all the precautions, because even immunized people, everybody for that matter, should be taking care, because we don't know what this mutant is going to do to even to immunized people, and don't be complacent. They have to take care of that.
Dr. Moopen, we're out of time. It's great talking to you. Really appreciate you taking time out of what I know is a very busy period for you. That is the voice of the founder, chairman and managing director of Aster DM Healthcare. Joining us on Microsoft Teams from his office here in Dubai, Dr. Azad Moopen.
Yeah, and if you have any stories that you would like